Okay, hello everyone and welcome. I will say some introduction about Manitoba Start, and Manitoba Start is a leading provider career services to newcomers in the province of Manitoba and connects business to a world-class workforce. I would like you all to welcome you all to this labor market connection webinar designed to assist you in entering the Manitoba labor market. Manitoba Start acknowledges that we are gathered in Treaty 1 territory, the traditional lands of Anishinaabe, Anishinawak, Dakota, Oyate, Denusulin, and Nehetoak nations, and the homeland of the Red River Métis. We acknowledge that our water is sourced from Cholal Lake 40 First Nation. As a newcomer organization, we commit to learning about the histories, cultures, and rights of the Indigenous community to strive to build a respectful and supporting relationship for all. My name is Luna, and I'm an outreach coordinator here at Manitoba Start, and I will be your host for this webinar. And given the large number of participants who have joined this webinar, we have muted your microphone to allow for better clarity and less interference. And before we begin, I will say a couple of housekeeping items. So if you do have any questions or comments, you can use raise hand. You can use the raise hand feature indicated that you have. So it will say you have a question or a comment, and you can click on the participants button in the meeting control and find the raise hand icon like this. And then you can next to your name and click on it and wait for the for me to unmute you, and you can ask your questions. And also the meeting, the Teams meeting has Q&A features, so you can also use this one to type your question. And if you are using your cell phones, you can also do the same thing as indicated here. So before we start and before I introduce you to today's webinar, I will go through a few polls, and I will give you some moments to answer the polls as well. Okay. Let's see. Oh, give me a second. Okay. Sorry about that. So we don't have the polls for today. I'll just go on with the introducing you for the presenter for today. So for today, we have the Red River College joining us, providing the language they are the Center for Newcomers Integration at Red River College Polytechnic, provides language communication training for internationally educated healthcare professionals, healthcare aid, and other healthcare workers. The CNI healthcare programs accept clients at Canadian language benchmark 5 plus and anyone with any status. And this session will cover the free language training programs that they have for everyone and the programs for people without background in healthcare who are planning to join or study or work in the healthcare in Canada. And they have like supports for newcomers, include English for healthcare, culture adaptation, and professional reintegration as well. And also the course area, they focus in communication skill, patient centered care, and navigating the Canadian healthcare system as well. So with this being said, I will give over this one to Heidi.
Thank you, Luna. Can you hear me okay?
Yes.
Okay, great. So good afternoon, everyone. Thank you so much to Manitoba Start for inviting us here today. My name is Heidi, and I also have with me my colleague, Agiram. We're from the Center for Newcomer Integration at Red River College Polytechnic, and we call ourselves the CNI for short, for Center for Newcomer Integration. So at the CNI, we offer training programs designed specifically for internationally educated nurses, doctors, and healthcare workers. And today we'll explain to you a little more about our program.
Thank you, Lona, at the beginning for important land acknowledgement you have provided. At Red River College Polytechnic Center for Newcomer Integration, we are deeply grateful to live and work on these lands. Our training programs reflect this respect by integrating Indigenous knowledge and promoting cultural safety, especially in healthcare settings. We are proud to support internationally educated healthcare professionals as they transition their skills and expertise to the Canadian healthcare system. Through occupation-specific language training and career-focused programs, we empower newcomers to build confidence, achieve licensure, and thrive in their chosen professions. And the key part of this journey is learning how to communicate with cultural humility and respect for all patients, including Indigenous patients and their families. I would like to pay attention of all the listeners today and also to share and ask them to share information with their friends, families, anyone you know in your community, that we have programs that are provided for free. I will go further. So if you are an international educated health professional and you're already working in healthcare setting in Manitoba, for example, as healthcare aides, this session is designed for you. You might not work as healthcare aide or any healthcare profession, but you might be educated you might be an international educated healthcare professional, doctor, physician, nurse, dentist, pharmacist. This presentation is the most interest and benefit for you. We know that many of you are busy working hard, supporting your families, and building a life here. We provide you free, practical training that can help you feel confident and move you forward in your healthcare career. Thanks to funding from the Government of Manitoba and the Government of Canada through IRCC, our health courses are completely free for naturalized Canadian citizens, permanent residents, refugees, and refugee claimants, work and study permit holders, including co-ed open work permit holders. Our training is available to almost everyone.
So thanks for that, Agiram. So we're going to start with a bit of an inspirational slide. This is Lila. When Lila arrived in Canada in 2017, she dreamt to work as a nurse again, but there was one big problem, probably the biggest of all. She didn't speak English. Manitoba Start referred her to CNI, and she worked really hard to learn English. She switched her phone to English. She studied every day, and she also volunteered with public health nurses, just following them around and watching what they do. She worked as a cook and also as a housekeeper to support her family, all while studying to learn about Canada's healthcare system. When COVID hit, Lila was able to help vaccinate our communities. So she wasn't just learning English, she was also functioning as a vital part of the healthcare team. Step by step, she completed her communication courses at CNI, passed her assessments, and then she entered the nurse reentry program. Finally, in January of this past year, she did receive her registered nurse license in Manitoba, and she's now working as a nurse. She's mentoring other new students, and she's building a support network for other Brazilian nurses. Slide. Perfect. So our courses address really three main areas. We can help you develop confidence in your English language and communication skills, and a deeper knowledge about Canadian healthcare culture and how the system works. We also offer practical opportunities. In our workshops, students can practice their communication skills through role plays and simulations geared towards the workforce. So this is a list of some of the courses that we currently offer. We're always designing new courses and our offerings often change. So this just shows you what we are offering now. Some more information about our courses. All of our courses for health are online. So they do not meet at the school, they meet online on a laptop or a computer, and most of the courses meet about twice a week, depending on the course. Some courses meet once a week only, other courses meet every day. Just depends on the intensity of the program that you're in. Our courses are live and they're interactive. So we have real instructors and real classmates. You're not just watching recordings, but you're actually participating. And most of our courses offer day and evening attendance options, so you can attend even if your schedule changes from week to week. We really try to keep our courses flexible and hope that they can work with your busy schedule. Next slide, please. Thanks. So just give you an example of one of our most popular courses here, Pronunciation for Health Professions. It's for students with CLB 5.6 and higher. That means you've already achieved a CLB 5.6 and you're working on the next level. You do not have to have a background in healthcare to take pronunciation, but you should plan to work in healthcare eventually. So PHP meets for 15 weeks. It's a one semester class. It meets twice a week, and it has 2 attendance options. So you can see here there it's 10:30 to 12 noon or 4:30 to 6. So when you register for a course like pronunciation, you don't have to register for just the morning session or the evening session. Instead, because a lot of our students work rotating shifts, you can choose each Monday which course to come to, the morning or the evening, and the same on Wednesday, morning or evening. Now, if it works for you to always attend the morning, that's fine, you can do that. But do know that you can mix and match, as we call it. Okay, I get them.
When you register for one of our courses, you will also get invited to optional health-related workshops and webinars. Each of these is a one-time event that lasts only for 2 or 3 hours. So webinars, we also provide them in the recording in case if you cannot join them live. So we encourage all our students to sign up if they have time in their schedule. Examples are standardized patient simulations. So we invite trained actors to perform patients and go through this scenario. Usually helps to our students with their licensure and skill exams. We invite speakers as guest speakers for to provide communication training on how to communicate with patients with dementia or those who are reaching the end of life. We provide writing and speaking workshops based on CELBAN, such as writing narrative reports or opinion letters or talking about current health issues. Here are just a few examples of the specific things we address in our training, such as writing a patient report, giving a patient update on the phone, reading, understanding a list of patient care instructions, participating in a team conference, asking politely for clarification, learning how to handle conflict with your supervisors, colleagues, and patients, pronouncing medical terminology.
All really important things. We know that the path to licensure can be confusing, and along the way, you may experience issues with things like family life, paperwork, finances. So one of my roles here at CNI is to support students in all areas and to direct them to supports that can help them during this time. So I'm available to help students decide which class or which course might be best for them, as well as make other referrals as needed. So I do meet with students online, one-on-one, to help you along the way if needed. Next slide. We hear again and again how much our students do appreciate our courses. Sometimes our students are a little bit unsure about taking an online course, but the feedback we get is really positive after students have finished the course. So here are some quotes just from two of our students. The first one is from Kuzia. She's currently a resident in the family medicine residency program at the U of M. She says, I wholeheartedly endorse your program and appreciate your help. And the second one is from Diana, an IEN, a nurse who's pursuing licensure with the RNM. And she says, I could not have done it without your help and support. So we're really passionate about helping our students and all of you. This slide shows the steps that you need to take to register for our courses. Every student at CNI does need a current WellArc assessment and referral. We actually use the WellArc scores to determine which courses are right for you. We don't want to put you in a course that's too easy for you. We also don't want to put you in a course that's too difficult. It can be very frustrating. We unfortunately cannot use IELTS, CELPIP, or any other language test scores. They do have to be WellArc. So if you're interested, you can follow the steps on this slide. You book your appointment and have your assessment, and then request a referral to RRC CNI MSSS program. That's really important. Then you can visit our website, fill out an online application, tell us a little bit about yourselves and exactly which program or programs you're interested in. And then you should hear back from us via email within about a week, and I'll let you know next steps. For most people, it's arranging an appointment with me. If you already have a WellArc assessment and it's less than 2 years old, you don't need to be reassessed. You can simply contact WellArc and ask to be referred to the RRC CNI MSSS program. We hope that you've found today's presentation helpful and not too overwhelming. Now we do have time for your questions, so you can raise your virtual hand or type your questions in the chat. And I think Luna will unmute you.
Yeah, that's right. Heidi and Agrim, thank you for the informative presentation. And I will be open to up to the audience. And then do you have any questions again? If you do have any questions, just raise your hand and I will let you in. You can, I will unmute you and then you can just ask your questions. Or you can also use the Q&A option to write your questions as well. So
I
we have
think.
a raised hand.
Mhm.
Yeah, I have allowed the camera call.
Yes,
Deep. Yeah,
yes, hi there. Um, I am looking like I'm trying to find a pathways to get my RN license, but I had to do the language assessment. I've already been working with Manitoba Start, and I gave a IELTS exam as CRNA mentions that they need to have not less than 7 in IELTS score, but specifically in writing, I can have 6.5, but I cannot go above 6. So it's the English language which I need to achieve. So Manitoba Start already told me to go to the VALARC to do my assessment. I was trying to get into the touch with the VALARC. I was not able to do that. And then I also tried to reach out the IRCC directly, but then they told me there are some college courses that I can take with the Assiniboine College because IRCC do not often, RRC does not offer anything else for the English language. So I just wanted to know more about these programs. Do I get a credits of these programs? Like, do I have to do the IELTS again after these programs to get my language proficiency test? Or these courses will be referred to the nursing organizations?
Yeah, so if you're looking to get certified using your international or your license from your home country, you will need to pass a language test, either an IELTS or a CELBAN. If you didn't pass it the first time, you'll have to retake it. We do
Okay.
have courses, absolutely, that can help IENs improve in their speaking, listening, reading, writing scores and prepare for a language exam. If your WellArc CLBs are 5 or higher, I'd be happy to meet with you. So if you want to take a picture there of the screen and send me an email at hdeffair@rrc.ca, then we can arrange a time to meet and speak further about your situation.
Perfect. I will email you with my IELTS test. I have given it in January 2025. It's just only my writing that I'm not able to achieve the score that the nursing organization need.
Yeah, well, we can look at our courses and see if any of them might be right for you and what you might be interested in. Okay, Kawaldeep?
Perfect. Thank you so much.
Thank you. Yeah, next question.
we have a question here.
Oh, yeah, here's someone about the WellArc assessment, I
Yeah.
see. Awaiting the WellArc assessment for nearly a year. So, Mohammed, I'm not exactly sure of your situation, but the first step, of course, is to email or call WellArc, and they should get back to you within 10 days. So if you haven't heard from them, then you need to email or phone them again. I mean, unfortunately, it is real life, and sometimes people get missed. It does happen, but you shouldn't be waiting that long to have an assessment. So keep call them back, contact them again. You can even walk in if you want,
Exactly. That's
go
what I
visit
was
them.
gonna say. Better to walk in.
Yeah,
Yeah.
better to walk
Okay.
in. Then yeah,
Yeah.
there's a saying we have in English. What is it? The squeaky wheel gets the oil. So you
Yeah.
need to be that squeaky wheel sometimes, unfortunately. I'm sure it's the same in your home countries as well.
Okay, thank you, Heidi. And we have Isan raise hand. I'll allow the mic and you can ask your question, Isan.
Hi, this is Hassan. I have a question. I want to ask about the CPR and first aid course.
Sorry, I can't hear you,
Yeah.
Isan. It's really
Um,
blurry. I wonder if you could try either come closer to the microphone or maybe type
okay,
into
I'm
the chat.
asking about the CPR and first aid course.
Sorry, which course?
CPR.
Oh,
CPR
she
first
typed
aid.
actually her question here. She's saying like I'm looking for CPR and first aid courses, I guess.
Um,
Is that correct,
the,
Isan?
Isan, is that true? You're looking for CPR and first aid?
Yes.
Okay. We don't offer those at Red River College or CNI. I mean, the easiest thing is if you go online and do a search, Winnipeg or Manitoba first aid CPR certification. But if you really can't figure it out, you can email me and I can send you some, get you started, send you some links.
Asan, you can also contact Manitoba Start. We do have like resources, and if you are our client, we have like some discounts that can be applied for you. So you can contact Manitoba Start as well.
And thank you, Suman Deep just shared in the chat that they went to St. John's Ambulance, and that is a reputable place to go.
Mm-hmm.
They offer all the time, always offering certification courses, so that's a good place. Thank you, Suman Deep.
And we have another question from Henok. He's saying, I have a bachelor's degree in pharmacy, so what is the next step to continue working as a pharmacist?
Well, that's less of a language question, I think, and more of a employment and pathways question. But I think Manitoba Star can help you with that. Can they not, Luna? There's people that can help with pathway.
We have career navigators, so you can connect with Manitoba Start. They will walk you through your career navigation. So I'll share our website and how you can contact us by the end of this Q&A, and then you can contact Manitoba Start.
And then another question here. I will take the test at WELARC on November 10th. What is the minimum score to integrate into the January English training? If you are interested in health-specific English training, you need to have a CLB 5 or higher, 5 in each skill area, so no 4s, 5, 6, and above. But CNI also does offer general English training for people with CLB 1 to 5. So if that's, to answer your question for health classes, it's 5, 6, or higher.
And we have another one from Sumandeep. He's saying like I have a valid certification in first aid and CPR from St. John's Ambulance, and then I'm looking for free online healthcare aid courses.
I don't know of any free online healthcare aid course. Now we do at CNI, we have a language and communication course for people who are already working as healthcare aides. Our course does not address the skills, the physical skills needed to become a healthcare aide. It doesn't give you a certificate, but it is communication skills for people already working as healthcare aides.
And one of our partners, that's Winnipeg Regional Health Authority, they provide uncertified healthcare aide training, which is paid, and then with the further employment, I would recommend you to search in the Google, in the internet, WRHA uncertified healthcare aide. We recently we owned the job fair with them. That's how we got to know about their training. That is something we can somehow help you with this advice.
Thanks, Agira, for reminding us of that. I'll just stick that in the chat. Again,
same.
How can I register for January English training? You need to contact WELARC, have an assessment, ask to be referred to Red River College, CNI, MSSS program, and we'll see what we have for you. There's the slide, perfect. You can take a picture of that slide if you need to. We operate on a semester schedule, so our courses generally start in September or late August, again in January, and then we have a quick spring semester in May and June. Occasionally, we have courses that start mid-semester or different workshops or things, but the best thing really is to speak with me to get your name on the list, and then we can also keep you on the wait list and let you know when the course is offered. One way that we decide what courses we might offer is by demand. So even if we don't have a course that suits you, if we get enough people who say, hey, this would be a really good course to have, that often we can design a course to meet the needs. So we do keep wait lists of people who are interested in different health-related courses. So even if we don't have something now, it's possible that in the future we could have something for you. Anything else?
Yeah,
Have
if
some
we
good
have anything.
questions.
Yeah, exactly. Again, you can I can unmute you. You can also ask questions or write in the QA chat. We have another one, I guess.
Or if there's a question that you don't feel comfortable asking, you can always email me. That's fine. Or if you think of a question later on. That's usually how it happens. After we hang up, then you think, oh, I should have asked that.
We have another question from Henok. Henok, if you can hear me, I will be sharing our website and how you can contact us by the end of this webinar. So you'll get all the information how you can proceed your career in pharmacy in Manitoba.
Question about certificates. Most of our courses are for personal professional development. So there is no certificate upon completion. Some of our courses that are more intense do offer a certificate. And so then again, it's just, you and I would meet, see what you're looking for, what fits, and decide what suits you best. We are looking in the future at offering some of our courses for credit, but that's not been 100% firmed up yet. It's a bit of a process. But like I said, most of our courses are for your own development. So you certainly could write them on a resume that you've completed them, or if you're in a job interview, you could let the interviewer know that you've completed these courses. Ayerim, would you say that's correct?
Yes, yes, and since we are part of the Red River College, though you enroll for free at the Center for Newcomer Integration, you enroll to Red River College college courses. Even though they're not for credit, you still can request for college transcripts, and all the courses, all the webinars and workshops you took with us will be listed on college transcript. And you will be also assigned the college credentials, college student ID. So you will enroll basically as college students, but to free funded courses and have training. So if your employer would need any kind of proof that you complete any kind of training, you can request transcript from Red River, which on paper or online, and present it wherever you need to present it.
I actually have a question for both of you.
Mm-hmm.
Where do you guys access to these webinars and workshops? Do they have to look to their website or
So
where do they
workshops,
register?
webinars, once we present them and we promote them among current students and past students. So those who are not enrolled to our Red River College CNI, they don't have any access and they cannot get the promotion and don't receive any kind of promotion for the webinars. But once you enroll to any of our training, which is long-term, semester-based or half semester, you will receive emails with the registration links for upcoming workshops and webinars.
Right.
That's great.
So you do have to be a registered student or
To get
recently.
access.
Yeah.
Okay, thank you so much. Great.
Good question.
Any more questions? I once again would like to stress out your attention that we accept immigrant clients with basically any immigration status except for tourists here. then in case if you are interested or anyone you know who might benefit from our training, please refer them to WellArc and then or share Heidi's email address, and we'll be happy to connect with you or anyone you refer to us.
Another thing here, like because some people might think like they're not eligible for WellArc because they are on study permit and work permit. So do you think
That
if
is,
they are,
yeah.
yeah,
That is why when you register to WellArc assessment, please indicate that you are interested at Red River College CNI MSSS program, which is basically the only program that accepts people with any immigration status, and that will also be an indicator for WellArc to accept you for free assessments.
That's great. Thank you.
Abakar says that he has a WellArc assessment, I understand. And so for this, I would recommend you to email to WellArc and ask them to refer to RRC CNI MSSS program. So we have internal system which connects the referrals. So for this, you would have to email to WellArc, ask them to send your assessment to us through our special internal system.
And also apply step number 3, then go online and complete an application so we know what program you're interested in. It's the fastest and the best if WellArc sends your referral to us and you also go online and complete an application. It's the best way to apply. And that, like that website there under number 3, it does have a list. You can browse through our website and it lists most of our courses. Like I said, our courses are often changing, but the most popular ones that we offer again and again are on the website, and it gives you an idea of what the courses look like, what they're all about. Again, these are language and communication courses, not physical skills, not injections or that kind of thing, but communication. There's some assessment as well, some charting and documentation, things like that. Anything that's language and communication related. And we find that, you all speak English. You're able to understand the presentation today. It's not that we're teaching you English. We're teaching you those next level skills that can be tough in your own native language, but especially in a second language, how to talk about death and dying, how to talk about, tough issues, how to just to have some of those hard conversations that can be really awkward and difficult. So come to us and we can hopefully help you improve your communication.
Great. So if we don't have any questions, maybe we can finish up here. Or, okay, we have another one.
Mm-hmm.
So,
If you're Tatiana there, if your WellArc results are from 2024, you don't need a new English. You took an RRC. I mean, as long as your WellArc assessment is less than 2 years old, you can use it to get referred to CNI health courses. So you just need a referral.
so she has to contact WellArc again, right?
Yeah, most people, what they do is they look at the referral paper that WellArc gave them and they look at the name of their assessor and they usually just email their assessor and say, can you please refer me to RRC CNI MSSS?
No, I see Tatiana among our clients. That's how, if I understand correctly, you did link courses with us, and yes. So Tatiana, just please email to Heidi,
To me.
hdiffer@rrc.ca, and then we will go from there.
Thank you.
Any other questions? Just in case if you have any questions that arise in your head later, please take a photo of these slides to email us later once if you think that you need to clarify something before going to WELARC or understanding that you need any kind of support in your language and communication training.
And we have another one, Marcella. He's saying, I get 5 for all these sections. Probably it's CLB 5, is that correct?
Yeah.
So that's great. So if you have CLB 5 and higher and you're interested in health courses at CNI, contact WELARC and ask them to refer you and fill out an application. And then we'll get in touch with you. Okay, thank you, everyone. Thanks for coming, and we hope to see some of you in our program.
So I have one last question, Heidi. For those who doesn't have any background in healthcare, so do you guys offer them like a special language training, like from scratch, or how does that work?
Yes, starting with CLB level 5-6, we do have a new course coming up, hopefully this spring. It's called Language Foundations in Healthcare, and that would be suitable for somebody with or without a background in healthcare who wants to work in healthcare in Canada. So even if you don't have a background in healthcare, but you might want to pursue a career in healthcare, also, we would have courses for you. We also have courses for people with higher CLB levels as well, with a CLB 777 and higher. We have a course that can be used to meet the English language requirements for nursing and other allied health programs at Red River College Polytechnic.
Great.
There's so many different courses and eligibility rules and different requirements about who uses what for what, which is really why I meet with most people that come into the program directly to look at your specific situation, your background, and your goals, and help you work through what we are offering either now or might offer in the future that will work for you.
Okay.
There for 3344, and you're a nurse. So like I said, our courses start for health at 5-6 or higher. So if you're a permanent resident or a refugee, then you would, with those scores, want to enroll in our LINK program, Language Instruction for Newcomers to Canada. That's our general English program. And so people would study in LINK for a few years. Those classes are either in person or online or hybrid. And then once you get to the 5-6, then you're referred over to health. So you would need general English. And to do that, that's just a referral to CNI. That's still, you have to go through. Well, if you have WELARC, or you have the WELARC scores already, you would just need to be asked to be referred to CNI.
We have another
No,
question. Yeah.
yeah, I see that question about about WELARC. No, because our courses are all paid by the government, by the federal government and the provincial government, they require everyone to go through WELRC. It's a condition of our funder.
If you think and you worry that you're in a very long queue with WELRC, I would recommend you complete their application one more time and once more indicate that you are interested in RRC CNI MSSS program, since healthcare is in a very big need here for the Manitoba, that you might your list or you might be prioritized for the testing. You might try this way. That's unfortunately how our funding works. I wish we could accept everyone with every training and every language certificate they have, but these are our constraints and we were working under them.
The other thing about WELRC, if you don't live in the city, they can do an online assessment, but it will take longer. So I don't know, for those of you who said that you've been waiting for quite a while, if you're waiting for an online assessment, it could be quick. I mean, a year is still too long to wait. You shouldn't be waiting for a year, but it is faster if you agree to come to WELRC in person and do the assessment. And when you do go for your WELRC assessment, if you haven't had it yet, remember, we determine your class placement based on your scores. So, try to go on a day when you have had a good sleep. Make sure you eat breakfast before you go. If you can help it, try not to take a child with you. Try to leave your children at home with a friend or a trusted neighbor. It's kind of important. And the better you can do, the more it will help you. And remember too, I think that when you go to WELRC, the assessment kind of starts almost the minute you walk in the door. Sometimes people are caught off guard. They get a low score because they say, oh, I didn't know that the exam had already started or that my assessment had started. But it does start. And so as soon as you walk in, even when you're talking with the receptionist, do your best right away. Because once you get those scores from WELRC, they will not test you again for 2 years. So you're stuck with those scores. Not to scare you, I'd like to share that with people so they know. Just so you can accurately represent your best abilities.
Thank you, Mohammed.
Thank you,
We still
Mohammed.
have time, yeah. If anyone wants to ask any questions, or maybe you can write as well.
Heidi, did I pronounce well?
Yeah.
Yes, hi. So I've sent you an email already. Do you receive it, or like should I confirm it? Do I have it right?
Here. Yep, there it is. I've got it. So I'll look at that afterwards, okay?
Okay.
Thank you. I will say we don't have, at this moment, we don't offer specific writing courses. We have in the past, and we might in the future. Right now, we don't. What is your immigration status, Kawaldeep?
I'm permanent resident.
Okay, so we have some things we can look at there too. So yeah, I'll reach out to you.
I have a total 7, like overall 7, 7 in each except writing. In writing, I'm stuck at 6. So,
Okay.
and the CRN, they need a 6.5 at least in writing too.
Right, for the IELTS.
Yes.
Thank you.
We still can accept like questions, and we can unmute you, or you can write in the Q&A or chat for more questions. So we have like 3 minutes to give you last chance to ask questions or to write up your questions as well.
All right.
Okay, so we will sum up and close. Thank you so much, Heidi and Agrim, for the informative presentation, and for everyone for your excellent questions. It was a really great webinar. And now I'll be sharing my screen and show you our website and how you can be connected with Manitoba Start. So as you can see here, Manitoba Start can help you with having like personalized career coaching uh, and settlement. If you are a newcomer, we have like settlement referrals as well that we can make for you. And we do have like job matching unit where you can be connected with employers. We do have so many events conducted by Manitoba Start. And if you are a newcomer or if you haven't registered with Manitoba Start, go ahead and register for our services. You can do that by coming in person or maybe go to our website and just open this one and register for services. Um, and also you can check our event calendars for so many events, especially this November. We do have so many in-person and online events that can be interesting to you. Maybe hiring events, networking events with employers, and also like information sessions with employers where you can get in-person feedbacks from the employers, resume critics, and other things as well. Um, we do have also our for credential recognition website open and live on the website, so you can just check if you are if you have a regulated profession, in trade, or maybe if you are a physician, nurse, or accountant. And Henok, you were like saying you were a pharmacist, so these are like licensed and regulated professionals in Manitoba. So just go ahead and check, and you can also be our client, register for our services, and you can meet one of our career navigators so that they can help you with your licensing processes as well. And with that being said, you can also contact us and follow us on social media so that you can not miss um, our events and webinars like this and hiring events that we have at Manitoba Stars. So you can follow us on LinkedIn, Facebook, and Instagram. And as I have said, you can contact us by this email, or maybe you can call us and also visit our website. Once you register, you can give us a call back so that you can book an appointment to meet one of our intake advisors and connect you with our services. Again, thank you for everyone for joining us today, and stay well. Have a good day.
Bye, everyone.
Bye.
Thank you.
Bye-bye.